everyone, welcome to SCube TV. I am your host Rajni Bharara. Today on the show, I have with me a very special doctor. Her name is Dr. Maha Laxmi. She is a fertility doctor and also a chairman at Arc Fertility, Gachibowli, Hyderbad. And today on the show, we are going to speak with her on fertility issues, and also we are going to raise questions on fertility. But before, let's welcome her to SCube TV and also to the show. Hello, Dr. Maha Laxmi. Welcome to SCube TV and welcome to the show.
Yeah, hello viewers. I'm happy to join you all here on the Scoop TV to share the knowledge and the awareness on fertility. So I hope this program would be of more use to those who are looking for various fertility treatments and who are looking forward to their parenthood too.
Yeah, that's, I'm sure it will be, doctor. And thank you so much for taking our time and doing the show. Now, I directly would like to, begin the topic of discussion, and I would directly like to ask my very first question to you. My very first question about fertility to you is, because we know that, infertility in women have so many reasons. So can you please point out some major reasons that causes infertility in women?
Okay. Actually, a decade before, it was always thought that only female fertility issues were major. So whenever like a couple didn't have a chance to have a conception, they used to blame the female partner alone and send her alone for fertility treatments. But now with a lot of awareness program, it's like being made very clear that it could be a couple issue, which means it could be either issues pertaining to the female partner alone, or it could be with the male partner or combined. Both of them could have a problem. So looking at the incidences, around 30% of the female partners do have an issue. And at times, around 30% of male partners have an issue. And 30% of the time, like both of them have an issue when they report to us for treatment. And out of the 10% of the couple coming to us, we find that there are no reasons, but still they have difficulty in conceiving. So when I look at the common causes of female partner, it can be they either have a menstrual irregularity or polycystic ovaries or any other issues like endometriosis or fibroids, so on and so forth. And the men usually they come with us with either an erectile difficulty or with dysfunction in the semen parameters, either the counts or the motility, something like that. So based on who is having the issue, we start addressing them and we try to sort out the issue.
Okay. But doctor, before I ask you about men, I would like to know what are the major reasons, the 30% you said, the problem or the cause is in women and 30% is in men and 30% is in both the couples. So let's talk about women first. So what are the major reasons that women go through infertility issues?
Okay. See, as we all know, globally, fertility issues are becoming bigger, which means the incidence of infertility is hiking. It's mainly because when you look at the women, the marital period, previously the age at marriage was quite early. Girls used to get married like at least close to their menarche. When they were around 18, 20, they used to get married, and the peak fertility period was between 20 to 25 years. So immediately after conceiving was always quite easier for them. But now, like women have also become more like they want to settle in their profession and everything. So they have shifted the marital age little later. Now, an average Indian working woman gets married around 27, 28. They don't want to get married earlier. So this is one of the major reasons why fertility is becoming an issue and infertility is hiking. So one is the age that's gone back from, say, around 20 to 27 or 28, postponing the marriage by 7 to 8 years has created a lot of issues. Two, previously, men used to work, women used to be at home. They used to take care of the family and make themselves available for enough family time, and they used to have a healthy sexual life. Now that both the partners are working, both the partners are put into a lot of stress, for them to have even a healthy sexual life is becoming very difficult. And they do work even during the weekends. So the availability of a single partner to the other is also become difficult. So they take night shifts, they work around the time, they come back, they're very tired. They do not have a quality time in their life, and the amount and time and quality spent to each other is also substantially reduced. So this is another reason. And three, if you see, the entertainment previously used to be like very restricted, like not much of malls, movies, theaters, outgoings, and everything. So it used to be just restricted to the home, and even sex was considered to be a pleasure. So people even thought that as to be an entertainment. But now, most of the time, people go to the other modes of entertainment, like they want to do trekking, they want to go for a tourism. So they're looking for the other kinds of entertainment. And this particular act of having a sex, they just think it as only for procreation, just to have a child, they want to have a sex. They really do not, except for the teenagers, those who are married, they really don't crave for sex these days. So, like going out, having dinner, going out, having fun with friends, these are all the culture that people are trying to follow now. So, whatever was being previously followed is now no more being followed. And when we again take the food habits, previously we used to have a very conscious, healthy Indian diet. But now most of the Western foods are into our country, and people are craving for all these fast foods, and they'll end up with obesity and all the other issues related to obesity. So this has also made it very difficult for them to have a child of their own.
Okay, so these reasons that we actually explained right now are not only restricted to women but also to men.
Yes, yes. When the
Okay.
diet changes, even men do undergo issues with their semen parameters and everything.
Okay, great. So, doctor, you explained in a great way these reasons, the causes of infertility in men and women. But you also raised a point of having sex. You actually mentioned that earlier in the early days, what used to happen that the mode of entertainment were not. I mean, so many mode of entertainment were not there. So people used to entertain themselves, or rather we should say, or enjoy themselves by having sex. But now what is happening is, because a lot of adventure is there, lots of modes of entertainment are there, so people are not much careful about it, and are I mean, not giving it as much importance as they used to give it earlier. So now I would like to know from you that for men and women, is having sex very important for not just for their mode of entertainment or for living in a society, but rather for also their body?
Yeah. See, we have to understand that having a healthy sexual life helps them to relieve stress. The
Okay.
stress hormones that are being released gets excreted out when they are into an healthy sexual life. And two, it is a mode of an simple exercise. When you are into an intense stress sexual act for the 5 to 10 minutes, you try to burn a lot of calories too. And three, the bonding that you get with your partner, the emotional bonding, is very important for a very healthier life. So when you really do not have a good sexual life, the bonding between the husband and the wife is not very strong.
Okay.
So there are many other reasons other than procreation as to why a very healthy sexual life is very important.
Okay, 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 got it. So, also, doctor, like you mentioned that now having sex is not considered as important as it used to earlier. So, can not having sex also cause infertility?
See, obviously, previously people used to have sex every day or alternate days. So, like asking them, advising them to have sex was not a routine. When people used to get married, the elders just used to explain to them what a sexual act is, but they never used to advise them to have sex frequently. But now we doctors, we are advising the couple to have sex frequently, because when the woman is ovulating, the sperms need to be in her reproductive tract for her to conceive. So when the couple just have a sexual act, say twice a month, so they hardly have any sex during the ovulation time or around the time of ovulation. So it becomes very difficult for them to conceive that particular month. So what we do, we look at their ovulation and we call the girl and tell her, see, you're ovulating around this time. So it's good you have sex at this time. So when we say you have sex at this time, this period of a week, this particular day, they plan and do it at that time. But from the male partner point of view, it becomes very difficult to have sex on a demand. When we tell the male partner, do it today, tomorrow, day after, it becomes very difficult for them. They are put into tremendous stress. So when it happens naturally, it's easier for both the partners to get into it. But when it happens on demand, the female partner is also not in the mindset to cooperate, and the male partner is not in a proper mindset to execute the sexual act. So a sexual act on demand becomes very difficult.
Okay, okay. So with this question, I also would like to add one more question to this question, doctor. So you explained how can not having sex also cause fertility. Now, the other question to you is can having too much sex also cause infertility?
It's not that way. So most of the time, people think that if they have sex twice or thrice a day, the fertility chances are better, because they compare with their friend who has a child, and they ask them and they say, we have twice a day, thrice a day. So they want to have once in the night, once in the early morning, and like that. It's really around the time of ovulation that should help them from conceiving. Like having too much of sexual activity is not going to harm them in any way. It's left to the discreets of the couple.
Okay, got it. So also now, doctor, one more question to you is, can having multiple partners, whether for a female or for male, can that also cause infertility issues? And also with this, after the infertility issues question, my other question to you is that how can it hamper, having multiple partners, how can it hamper a male or female's body, if it can?
Okay. See, when you say the act of having multiple sexual partners itself, it's a source of having a sexually transmissible infection. So we don't know how many partners in them are already having multiple partners.
Okay.
Okay. So it's not only this particular, you take a female, she has, say, 4 or 5 sexual partners. In that one sexual partner can also have another 4 or 5 sexual partners. So it's a very source to have transmissible sexual diseases. So they need to be very cautious of not spreading the sexual diseases across to the other person. And this sexual diseases per se is a reason for fertility. Like when you have all the bacterial and the viral infections going on, that itself is a reason for infertility. Okay. So it is very essential to have a very safe sex, not to transmit disease to your partner, nor get infected from someone else.
Okay, got it. So also, doctor, I would like to now speak to you about vaginal discharges. So are there different types of vaginal discharges, and of which a vaginal discharge should women be worried about?
Okay. See, it's very normal to have vaginal discharges. Okay. So having a leukorrhea or a white discharge is normal. But around the time of ovulation, around the time of menstruation, we call it physiological. It's normal. But if a female finds that she is symptomatic, like the discharge is foul smelling, or creating any symptoms of itching, or she has lower abdominal pain, it means she needs to seek medical attention for it. So that cannot be taken as normal.
Okay. So also, will these products available in the market? I mean, those vaginal washes for, does they help?
Yeah. Yeah, I wanted to tell you the vaginal washes, douches, these are all not being promoted by doctors. See, it plays with the vaginal pH. Okay. So we doctors really do not recommend it, but it is like most of the pharmaceutical companies, they have bought all these things. So when a particular woman is having a white discharge, we need to look at what is the organism grown and treat it accordingly. And a routine vaginal douching is not going to help them in any ways.
Okay. But doctor, a lot of people don't know, especially women, they don't know about it, and especially the office going ones and the young ones. So rather than those vaginal washes, what would you like to recommend for women to clean their private parts?
See, actually, gentle soap and water should be more than enough. Douches should not be used unless or otherwise recommended by doctors.
Okay.
So whenever it is symptomatic, I think in India, it's not very difficult to get a medical advice. If people are staying abroad, I understand it's going to be very difficult for them to get a medical advice. But in India, it's not going to be of difficulty.
Doctor, also, if a couple is trying to conceive, so is there a way to get pregnant faster?
It's only like you don't postpone your pregnancy. So, and then have adequate knowledge of how to have the sexual life. And they can either use an ovulation kit to know when she's ovulating, or take medical assistance to know when she's releasing the egg, and have a planned sexual intercourse around that time.
Okay.
An early marriage helps them, and a premarital screening, like trying to screen them before marriage, definitely helps them to have better chances of pregnancy.
Okay, got it. But doctor, now in today's time, surrogacy is also, people are also taking help of surrogacy. So for the ones who don't know about surrogacy, I would like to know from you. When a couple decide to, to have a child via surrogacy, so does the genes of the person carrying the baby also, does that also come? Or, I don't know how to put the words, so if you can please explain about it.
Okay. What we need to understand is couple doesn't decide for surrogacy.
Okay.
For a couple to undergo a surrogacy program, strict medical guidance is needed. Okay. And the doctor should be genuine in recommending a surrogacy program for them. It's like not they have a surrogacy program for their comfort of not conceiving. So only if there is a strong medical recommendation, a couple could undergo a surrogacy program. And our Indian law is very strict on surrogacy program. So when they undergo a surrogacy program, if the egg of the female partner and the sperm of the male partner is used, then there is no genetic transmission of the surrogate mother to the baby. Okay. And according to the Indian commercial surrogacy law, the egg of the surrogate mother cannot be used. So that there is no way that there can be genetic transmission. If at all the couple opts to have a donor program, either a donor egg or a donor sperm, then the genetic material of the donor, either the egg donor or the sperm donor, get transmitted to the child. But if the couple's gametes are being used, there is no biological genetic transmission of any other chromosomes to the baby other than the parents.
Okay. Thank you so much for the confusion out. Thank you so much for answering it so beautifully. So, doctor, also, in the beginning of, while I was asking you one question, you mentioned that how age is very important for, to help in pregnancy. So in today's time, like you mentioned that because women want to settle down, they want to have a career, they want to do jobs. So which is why they are getting married later, and which is also hampering somewhere their married life, their sex life. So if I ask you, does age, how can a woman, even if she decides to get married later, how can she still have a healthy body and a good sex life and a good pregnancy?
Okay. I think routine medical visits is important. So she has to make sure that she is physically fit enough always. See, there are two things. One is the biological age and another one is the chronological age. Okay. So when I say chronological age, it goes with your date of birth.
Okay.
You are 1975 born and you are around 45 to 46 years now. That is your chronological age. That cannot be changed. Two is your biological age, wherein we see what your body is aging, whether you are pushing gray hairs, whether you are already balded, whether you are running out of your eggs. So that is your chronological age. That is your biological age. So what we see is we can have people at 40, 45 years still having lots of eggs, which means she is older by age, but biologically she is younger. At the same time, we find younger girls around 30, 32, but with depleted egg reserve, which means although she is younger, biologically she's older. So I think we need to take a proper medical guidance. And if a girl is planning to postpone her marriage, she has to take proper advice as to whether it is advisable for her to postpone her marriage or not.
Okay. Okay.
So just postponing is going to raise a fertility issue, then she should not be opting that. Two, if she has valid reasons for postponing her marriage, then she can go for an oocyte freezing program. Like she can take her eggs, get it frozen, like male partner, he has a really valid reason. He can take his sperms and freeze it. So that is also possible. That we usually do for all those patients who are undergoing like treatments for cancer and everything.
Okay. Okay. So, doctor, what is that one particular age that a woman or a man should decide? Okay, now I think they should go visit a doctor if they are not planning to get married soon.
Okay. According to me, for a female partner, the ideal age for marriage is between 22 to 25. And for a male partner, the ideal marriage life should be between 27 to 28. So if they are planning to like postpone their marriage beyond this age, it's better they have a medical opinion and then take a second thought.
All right, got it, got it. So also, doctor, one last question to you. So how many types of abortions are there? And are there any supplements or vitamins that a couple should start taking if they are planning to get pregnant?
Okay. So any female partner planning to have a conception should take replacements with folic acid and vitamin B12.
Okay.
So at least 1 or 2 months prior, she plans for her pregnancy. Okay. And when you take miscarriages or abortions, there are different kinds. So one can happen because of genetic reasons. Two can just happen because the womb of the uterus is very weak.
Okay.
Okay. And few other metabolic reasons like blood sugars could be high, or they can have a thyroid abnormality that can also land up in miscarriages. And we have a valid reason called antiphospholipid antibody syndrome, wherein everything is normal, but she just carries few antigens in her body and repeatedly miscarries. So a miscarriage is usually not always of same etiology. Each female can have a different reason to miscarry a child. So even like the shape of the uterus could be different, or the husband's sperms may not be too good. So there are various reasons. The tubes can have hydrosalpinges. So knowing the reason is more important to treat the cause.
Okay, okay, got it. Thank you so much, Dr. Maha Laxmi, for coming to SQ TV and speaking with us. You actually educated us in such a beautiful way, and you cleared out all the confusion in such a beautiful way. So thank you again for taking out time and doing the show.
Okay, thanks for giving me the opportunity. So ARC has its 27th branch at ARC Hyderbad, Gachibowli. I'm sure this is going to serve most of them seeking to have a healthy child, and for all the other childless couples too. Thank you.
Definitely. Thank you so much. All right, guys, that's it from SQ TV. Keep on watching and do subscribe to the channel.
Sure. So when will this get relayed? Any idea?
This will be, I think, either on Monday or Tuesday.
This Monday or Tuesday?
Yeah. Because tomorrow is Sunday,
Okay.
so the editing will be done. I think maybe today evening or on Monday, and then they'll be posting it either on Monday evening or Tuesday.
Sure. Thank you. Thanks for giving me the opportunity.
Of course, it's a pleasure. Thank you so much.